Welcome to the course Mental Health and Wellbeing. That is module number 4, Advanced Skills for Mental Health, and lecture number 3, Introduction to Therapy and Counseling. I am Ansuman Arjari, clinical psychologist. So we'll discuss here in this topic basically like to provide learners with a foundational understanding of therapy and counseling, understand the personal, psychological and social benefits of therapy, identify the signs and symptoms indicating the need for professional mental health support, understand the foundational principles of major psychotherapy approaches, understand the primary responsibilities and roles of a therapist, identify and understand the widespread myths and misunderstanding about therapy, and lastly, understand the importance of trust, empathy and rapport in therapy. So, in introductions, like therapy and counselings are professional services that helps individuals to cope with emotional, psychological and behavioral challenges. Counseling often focuses on specific issues and that is typically short term, while the therapy addresses the deeper mental health concerns and may be a longer term. Both aims to improve mental well-being, provide support and promote personal growth through the guided conversations with trained professionals. Psychotherapy is an approach for treating mental health issues by talking with a psychologist, psychiatrist or another mental health providers. It's also known as the talk therapy, counseling, psychological therapy or psychosocial therapy or simply therapy. So, by definition, therapy given by the Wolbach in 1967, psychotherapy is the treatment by psychological means of problems of an emotional nature in which a trained person deliberately establishes a professional relationship with the patients with the objects of removing, modifying or retarding the existing symptoms, of mediating the disturbed pattern of behavior and promoting of a positive personality growth and development. On the other hand, the counseling definitions given by the 1945 by Goat define counseling as a individualized and personalized assistance with personal, educational or vocational problems. This assistance involves studying and analyzing all pertinent facts, seeking solutions with the help of specialized like schools and community resources and personal interview, where the individuals learn to make their own decisions. So, these are the differences between the counseling and psychotherapy. In practice, like counseling is practiced by the counselors and counseling psychologists. On the other hand, the therapy is practiced by psychiatrists, clinical psychologists, medical social worker. And counseling mainly focus on better personal adjustment, deals with everyday normal problems like adjustment in schools and academic problems. And on the other hand, psychotherapy focuses on to help the individual to address and resolve mental, emotional or behavioral issues, ultimately promoting well-being and then personal growth. Counseling is short durations. On the other hand, the psychotherapy takes longer duration and the number of sessions is higher than the counseling sessions. Settings basically practice in different settings apart from medical and clinics like in schools, sports setting. On the other hand, therapy and psychotherapy is practiced mostly in the medical settings and the goals is to assist client adapting to immediate life challenges, to facilitate insights and emotional healing at a deeper level. And terminology counseling in like we refer as a counselor and client. On the other hand, psychotherapy we refer as a therapist and the patients. So, there is some kind of benefits of therapy. So, this like there are multiple benefits like including improve emotional well-being, reduce symptoms of mental health disorders, better coping strategies and enhance interpersonal relationships. The research consistently shows that the psychotherapy is effective for treating conditions like anxiety, depression, post-traumatic stress disorder and like obsessive compulsive disorder, like eating disorder, substance use disorders. It also fosters a personal growth and self-awareness and resiliences. Emotional, there are like multiple benefits apart from like among them the emotional and psychological benefit is one of the most important component that reduce the symptoms of mental illness like depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder. Symptoms can be significantly decreased with the help of therapy. Like one of the most common therapeutic model is the cognitive behavior therapy, which is specially used for the anxiety and depressions, and it's showing effective. Improve emotional regulations. Therapy helps an individual to understand and manage their intense emotions like anger, sadness, anxious. Enhance self-esteem. Client reports like increased confidence and more positive self-images after therapy sessions. Interpersonal and relations benefits. Improve communication skills, especially effective on couples and family therapy. Healthier boundaries. Therapy teaches clients to set and respect personal boundaries by developing a kind of assertiveness skills. Conflict resolutions helps reduce relational distress in personal and professional settings. Physical and behavioral health benefits. Reduce stress and physical symptoms. Psychotherapy can lower the stress related physical issues like headache, gastrointestinal issues by practicing some kind of relaxation training like Jacobson progressive muscle relaxation training or just relaxation training or physical muscle relaxation training. Better coping mechanism. Client develop healthy ways to handle stress and adversity. Behavior change helps address substance use, eating disorders and compulsive behaviors. Societal and functional benefits of a therapy. Increase productivity and focus. Improve like concentration and reduce absenteeism, and then improve like attention and concentration. Greater social functioning. Clients often report more satisfaction in community and work roles. Preventive impact. Early intervention reduces the long-term burden and healthcare system. But there are some limitations of therapy. Like for example, in spite of having multiple benefits of therapy, there are some kind of limitation and considerations of a therapy. These are like therapeutic fit. Success depends only when there is a relationship and therapeutic model is fit with the particular problem that the student or person is going through. One of the barrier is like the stigma. Stigma may prevent to access services because of like what society will say if I go to the counseling service, if I go and talk to the psychiatrist, if I take help from the psychiatrist. So this stigma to some extent prevent access of taking services. Access and affordability. Not all the individuals can access easily therapy because of some kind of like financial issues and then availability of mental health professionals. When and how to seek this professional help? So, help seeking is a psychosocial process where an individual recognizes a problem and seek external assistance to get rid from the mental health issues or any kind of psychological issues. So, when to seek help? So, there are some indicators like psychological indicators. Seek help if emotional or behavioral symptoms persist for more than 2 weeks and interfere with daily functioning. Like we all know that to some extent we are experiencing some kind of emotional distress, like for example sadness, anxiety, restlessness, sometimes aggressions. But it does not mean like everyone is having mental health issues. So when do you have to go for seeking mental health issues is to some extent like when this particular symptoms is like continuously affecting you and it's like persistent at least more than 2 weeks, then to some extent we need to consider to seek help. So like persistent sadness or anxiety, when you are experiencing like persistent sadness and anxiety, then you can approach to the mental health professionals. Excessive fear or panic attacks, when you are experiencing like excessive fear or irrational kind of fear, then you can approach the mental health professional. Intrusive or obsessive thoughts, mood instability, like suddenly you are experiencing changing your drastic change in your mood, like for example from happy to sadness, sadness to happy, anger, irritation, then to some extent we need to consider that we need help. Thoughts of self-harm or suicide, if you are experiencing any kind of thoughts that is related to harming self or suicidal or to some extent harming to others, then to some extent you need to approach or take help from the professionals. Behavioral and social indicators, social withdrawals or isolations, drop in academic or work performance. If you are observing yourself drastically there is some change in your work performance or academic performance, then to some extent you need to identify that yes, you need help from the professional. Sleep disturbances, substance misuse, suddenly if you experiencing like a drastic change and you are misusing substances like alcohol, cannabis, tobacco, then to some extent you need to consider. And characteristic aggressions or apathy. So, who to approach? Type of professionals like professional psychiatrists, clinical psychologists, counselor and social worker or medical social worker, they are basically working as mental health professionals. So, in qualifications and focus area like psychiatrists are basically MD, specialization in psychiatry, and they prescribe medication management and diagnosis. Clinical psychologists by qualifications, they are MPhil in clinical psychology or PhD in clinical psychology. The main focus area is the assessment and then providing psychotherapy. Counselors, their master degree in psychology or counseling, they basically focus on the talk therapy, stress and lifestyle management. Medical social worker or social worker, they are MSW or equivalent. For example, medical social worker or psychiatric social worker, they are basically focused on the community resources and then basics therapy. So, how to seek help? For example, you identify that you are going through with some kind of emotional issues or psychological issues, then where and how to seek help. This is like, for example, self-initiated steps, acknowledge distress and symptoms, identify what kind of symptoms you are experiencing. Then research appropriate professional types. Based on your symptoms, you decide whom to meet. For example, like psychiatrists, for example, like counselors or clinical psychologists or counselor. Schedule and initial consultations as we do in other medical health conditions also. Access pathways like institute, university counseling service. If you are having some kind of centers like in your institute or in your department, for example, mental health professional, well-being center, counseling service, then you can approach to them. Employee assistance program is there. Hospital and clinics, like you can go to the government hospitals like Government Medical College, district mental health, primary health center where there is a district mental health program is there. Online platforms like Telemanas, you can call to 14416 where apart from Hindi and English languages, they provide 20 another regional languages for counseling. I call free telephone and email based counseling service. Barriers to seek help like stigma, lack of awareness of symptoms and services. Sometimes the people who are experiencing this kind of symptoms may lack awareness or identify that yes, this is something mental health issues. Accessibility due to geographic and financial and cultural barriers. Gender norms and resistance to vulnerability. Facilitator of help seeking like psychoeducation, campaign and mental health literacy, social support, encouragement from family or peers to take help for mental health professional, positive past experiences with therapy, cultural competence in professionals. So, there are different types of therapy approaches, like the most common approaches are like psychodynamic therapy. It's like developed by or originated with the Sigmund Freud, emphasized on the unconscious process, childhood experiences, intrapsychic conflict. And technique like free association, dream analysis, transfer and counter transference, goals basically insight into unresolved issues and defense mechanisms. Humanistic therapy developed by Carl Rogers and Abraham Maslow, emphasized on personal growth, self-actualization and authenticity. Core concepts basically on unconditional positive regard, empathy, congruence, approaches like client-centered therapy, gestalt therapy and existential therapy. One of the most common and widely used therapy approaches is like cognitive behavior therapy, which is we usually refer as like CBT. It's developed by the Aaron Beck and Albert Ellis, focus basically on the link between thoughts, emotions and behavior, how thoughts generate some kind of emotions like anxiety, sadness, irritations and anger, how and these emotions is to some extent affecting our behavior. The key techniques, cognitive restructuring, it's like basically focus on the thoughts that is generating because of some particular events or situations. And then behavioral experiment, thought records, exposure therapy. This cognitive behavior therapy is basically applied mostly in the depression, anxiety, obsessive compulsive disorder and post-traumatic stress disorder and eating disorders. Behavioral therapy is based on the principles of classical conditioning and operant conditionings developed by the Pavlov and Skinner. Key methods like positive and negative reinforcement, systematic desensitizations, token economies and aversion therapy. This behavior therapy is basically used with the patient, those who are experiencing kind of a fear like phobia, addiction like substance use, and then developmental disorder in children like autism, like mental retardation, cerebral palsy, to sense some kind of their maladaptive behavior or problematic behaviors. Then this is a third wave and integrative therapies like acceptance and commitment therapy, emphasize on mindfulness and value-based living. Dialectical behavior therapy combines with CBT, cognitive behavior therapy with emotional regulations and interpersonal skills. This is developed by Linhan in 1993. Mindfulness-based cognitive therapy is one of the most common, combines with the CBT strategies. Integrative approach combines with multiple module based on the client needs. The role of therapists in the counseling process, the fundamental roles and responsibilities of the counseling process, how the therapist plays a role. So a therapist is a trained professionals who facilitates psychological healing and personal growth by fostering insight, emotional awareness and behavior change. Key functions like of the therapists or the counselors is facilitate clients in self-discovery and then resiliences, provide safe and non-judgmental spaces, use of intervention to promote change in their behavior, ensure ethical and professional conduct. The therapist role basically like facilitator, guides client self-discovery through dialogue, assessor, evaluates client's needs, pattern and symptoms, educator provides psychoeducations about emotions, behavior, etc., support system, offers emotional containment and validations, ethical guardians like uphold confidentiality, informed consent and safety of the clients or the patient, cultural navigator, demonstrates sensitivity and diverse backgrounds. So, how to build this therapeutic alliance with the client? The therapeutic alliance is basically a kind of collaboration between the client and therapist based on the trust, agreement and then mutual engagement in task. Three core components of elements of the therapeutic alliances like goals, agreement on desired outcomes. The client and the therapist will agree which part of behavioral problems or in emotions they will work on that. Task, agreement on therapeutic methods, which kind of therapy they will adopt for the therapeutic sessions, and then bond, trust, empathy and understanding. Practical techniques for building alliances like building rapport, greet the clients whenever these clients enter in your clinics or office warmly and establish initial comfort and then show consistent, authentic interest in the client's well-being. Active listening is one of the most important technique in building alliances. For example, reflect client statement and demonstrate understanding of the client's problems, avoid interruptions when the client is talking, respond to the emotions as well as content. For example, therapy is only for crazy people. Sometimes people think like therapy or counseling is only for the people who are crazy. Like for example, people who are act in a very erratic way. But in real, therapy is for everyone, anyone experiencing emotional distress, life challenges or seeking personal growth. Therapy is a form of mental wellness, not a sign of illness or instability. According to American Psychological Associations, people seek therapy for stress, relationship, grief, trauma and self-improvement, not only for the crazy people. Misconception 2, talking to friend is just good as therapy. But in reality, while social support is vital, therapists are trained professionals. Therapists offer evidence-based technique, confidentiality and objectives insight. Therapy provides a structure process with clear goals and measurable outcomes. Therapists will judge me or tell me what to do. Like in reality, again, like therapists are non-judgmental. If you express your problem, emotions, how you are going through with the problem, it does not mean that the therapist will judge or about your problems. So therapists are non-judgmental and help clients to explore their own values and solutions based on unconditional positive regards. And the goal is to empower, no direct or criticize. Therapy takes forever. In reality, like many therapies are time limited and goal oriented. For example, cognitive behavior therapy takes around 10 to 20 sessions. Like solution focused therapy is a brief therapy process. Duration depends on the client needs and goals, not a fixed lifetime. Therapy is too expensive. Sometimes it's expensive, but there are multiple affordable and free of cost options are available. Like for example, government or university clinics, online therapy platform, as I mentioned, like Telemanas or iCall, group therapy and sliding scales modes. Therapists have all the answers. In reality, therapies facilitate only self-discovery and guide clients towards their own insights. The therapeutic model is often client-centered, not advice-driven. Empowering the clients is a key principle. Therapy is only about the past. In reality, different therapies focus on different time frames like CBT, DBT or ACT. ACT is like acceptance commitment therapy, focuses on the present, challenges and skills. Psychodynamic therapy explores past influences, and many modern approaches are future oriented and solution focused. So impact of misconception, because of the misconception, how these things impact in our society. Like one is like stigma and misinformation prevent individuals from seeking help. This kind of misconceptions prevents in a society, and this will prevent individuals from seeking help. These myths contribute to underutilizations of mental health service. This kind of misconceptions like spreads in the society, and this will to some extent impact the people of utilizing the mental health professional services. Educating the public is crucial for early intervention and mental wellness. And in summary, therapy and counseling supports individuals in managing emotional, mental and behavioral challenges. Benefits include improved coping skills, emotional well-being and self-awareness. Professional help should be sought when issues impact daily life or feel overwhelming. Common therapy approaches include like cognitive behavior therapy, psychodynamic therapy, humanistic therapy, each offering different strategies for healing. Therapies guide the process, offering support, insight and a safe space for growth. Misconceptions such as like therapy being only for serious problems or offering quick fixes can deter people from seeking help. A strong, trusting therapeutic relationship is the key effective counseling and long-term personal development. Thank you, and these are the references.